Hello friends, welcome to my YouTube channel Neuron Pain Clinic. Myself Dr. Rajendra Sahoo, consultant pain physician at Neuron Pain Clinic and KIMS Hospital, Bhubaneswar. So in this video I am going to show you how to scan the anterior neck for performing a safe and effective stellate ganglion block or cervical sympathetic chain. The stellate ganglion block is typically done under ultrasound at C6 level. Sometimes it can be done at C7 also if you see there are no major blood vessel there. So C6, C7 is identified by the tubercles. So the transverse process divide into tubercles on the lateral side. Anterior tubercle, like at C6, anterior tubercle is prominent. This is posterior tubercle like this. This is a pointed anterior tubercle which is known as Chassagnus tubercle. At C5, this is same height, C5 and anterior and posterior tubercle. The nerve root comes out between the tubercles. At C7, there is no anterior tubercle, only a posterior tubercle, like a thumbs-like appearance. This is a posterior tubercle and there is nothing on the anterior side. You can see the vertebral artery medial and the nerve root coming out of the foramen. However, in around 7% of the individuals, the vertebral artery can be outside the foramen at C6 level also. So keep that in mind while scanning. So don't look for the presence or absence of vertebral artery for counting the labels. It is rather the absence of anterior tubercle C7 and pointed anterior tubercle at C6. So this identification helps in performing the cervical nerve root blocks or the paraforaminal or the foraminal blocks under ultrasound guidance, as well as doing a stellate ganglion block. So for a stellate ganglion, I usually position the patient in the left lateral, on the lateral position, lateral decubitus, start scanning on this neck here. This is a high frequency linear probe. Left is going to be anterior or medial, right is lateral. So here these are the tracheal rings. So this is the strap muscles, sternocleidomastoid, this is the thyroid gland, carotid, IJV. So that is the esophagus there. Okay, as I slowly come lateral, sternocleidomastoid, carotid, IJV, the muscle and the transverse process that you see, that is your longus colli muscle. Okay, so now that I have to identify which is C5, C6. So now I'm little down actually. Let me show you very nice anatomy here. So this is my C5, this is my C6, this is C7, that is vertebral artery there. Anterior scalene muscle, this is the middle scalene muscle, that is for the interscalene block for the anesthesia. As I slowly go up, that is the posterior tubercle C7, that is C7 nerve root coming out of the foramen, that is the vertebral artery, if I put color, vertebral artery and vein. Okay, so that is C7, both look hypoechoic similar. So C7 root, vertebral artery, this is medially. As I slowly, so here, see here, there is posterior tubercle, no anterior tubercle. As I slowly go up, this is my C6 nerve root coming out. That is anterior tubercle, this is posterior tubercle, and that is C6 nerve root. As I slowly go up, this is C5 root coming out of the foramen, anterior and posterior tubercle. So let us focus on the C6. This C6 nerve root, anterior tubercle, and the posterior tubercle. I'll slide my probe medially like this. Focus here. So this is that C6 Chassagnus tubercle. This muscle is longus colli muscle. That small is longus capitis. This is the prevertebral fascia. So the cervical sympathetic chain lies just below the prevertebral fascia on the surface of the longus colli muscle. So it is very important to identify the longus colli capitis and the prevertebral fascia for a safe and effective performance of the stellate ganglion block. So once I identify this C6 level transverse antitubercle, longus colli and capitis, I drag my probe further medial. I'll keep in this manner. Okay, keep in this manner. This is that prevertebral fascia, hyperechoic line. I'll put my needle in plane like this, stop here after piercing the fascia. I'll deposit on the surface of the longus colli, the local anesthetic. Needle will go like this from here, from lateral to anterior, and my target is here. Look here, it looks like hyperechoic line. They're like perimysium, the fascia inside the muscle. So if I go a little up, one can appreciate the very well two muscles, capitis, colli. So here on the surface of the longus colli, beneath the prevertebral fascia, that is my target. I typically use 4 to 5 ml of local anesthetic. That is good enough. Studies have shown if it is a subfascial, that means below the prevertebral fascia on the surface of the muscle, so that will go all the way down to T2 level. to block the nerve, 4 to 5 ml. So judicious performance of sympathetic chain block is very key. Here under ultrasound guidance you can avoid nerve root, aberrant blood vessels, esophagus, trachea, the IJV, carotid. Even if sometimes you puncture or go through the IJV, that is okay. You just need to appreciate that not much happens actually. You can put a bit of pressure there. Thank you very much. I hope you understood that part, and if you like it, don't hesitate to subscribe and share among your friends. Thanks again.